Hello everyone, it's me, Dr. PSB from Neurology. So today I'm going to go over some general information regarding strokes. Now there are many different types of strokes, but today I'm going to go over ischemic strokes. So what exactly is an ischemic stroke? An ischemic stroke is when someone has an occlusion or a blockage of an artery or more of the brain, and that area of the brain that's being supplied by that artery doesn't get enough blood flow. So that area of the brain becomes damaged. That is generally what an ischemic stroke is. And you can see many different types of symptoms in ischemic strokes. Just because two patients have had strokes doesn't mean that their symptoms will be the same. Some general symptoms may include facial droop, numbness and tingling on one side of the body, weakness on one side of the body, changes in vision, and much more. It really depends on which area or areas of the brain were affected. The brain is extremely complex, and different parts of the brain play different roles in the functioning of our body. There are many different risk factors that accumulate and lead to strokes. One of the number one risk factors for strokes is hypertension or high blood pressure. Other risk factors for stroke include diabetes mellitus, heart problems like atrial fibrillation, also casually known as irregular heartbeat, obesity, smoking, and other poor lifestyle choices like drug use or alcoholism. Other risk factors include hypercoagulable states, or clotting disorders where people clot more than they're supposed to. And even COVID can be a risk factor. So let's say you've had a stroke. What now? Well, unfortunately, the damage that's done to the brain from a stroke cannot be 100% reversed. We cannot necessarily take away or cure that stroke that has already happened. But what is important is secondary prevention. In other words, preventing future strokes from happening. Because if you've already had a stroke, that is a risk factor for future strokes as well. Prevent future strokes from happening. How can this be done?
Let's go into stroke prevention measures.
Your doctor may prescribe you with some medications, including aspirin and a statin medication. Usually in my experience, it's been baby aspirin, or aspirin 81 milligrams once per day, and a statin like atorvastatin. But of course, every individual is different, so your doctor may give you a different type of statin, or maybe not at all if you've had other side effects from it, etc. It really depends on a case-by-case basis. But generally speaking, they may prescribe you with blood-thinning medications like aspirin, or if you've been taking aspirin on a daily basis and you still ended up having a stroke, it is possible you may be switched over to another blood-thinning medication. It also depends if you've had bleeding history, so talk to your provider regarding this. But why are blood-thinning medications important in patients who've had ischemic strokes? Well, blood thinners help to reduce the risk of clots forming and going to the brain by thinning out the blood. Some blood thinning medications have a greater risk of bleeds than others. So if you have any questions regarding this, feel free to reach out to your prescribing doctor. And what about statin medications? Statins are important because they stabilize plaques in the body. Those plaques have the potential to break off, go into the brain, and also cause strokes. That's where statin medications can help out. Otherwise, it's very important to control any risk factors that you may have for strokes. For example, if you have high blood pressure, it's important to check your blood pressure on a regular basis at home. You can also buy blood pressure cuffs from your local pharmacy or even online. I generally recommend that my patients who have high blood pressure check their blood pressure every day for at least 4 days per week, 3 times a day, once in the morning, once in the afternoon, and once in the evening, at the same times each day, and record their readings on a sheet of paper. Then they can talk to their primary care doctor about their readings, who can then adjust their blood pressure medications as needed by taking a look at their pattern of blood pressure readings. Because sometimes we may not even know what our blood pressure is on a regular basis when we're at home. And that's important to know, especially if you've been diagnosed with high blood pressure already. Additionally, it's important to take your blood pressure medications that your doctor has prescribed to you and as prescribed. Taking other healthy measures to control your blood pressure is also helpful, like reducing your salt intake or getting regular exercise. And I'll go more into this a little later. And if you have heart disease, follow up with your cardiologist, your heart doctor, for management and treatment of that. The reason why is because many times strokes are caused by issues with the heart. For example, like clots that form in the heart and then go up to the brain and cause strokes. So if you have heart disease, Seek guidance from your heart doctor. If you have diabetes, it's important to control those blood glucose levels or those blood sugar levels. So, similar to blood pressure, it's important to check your blood sugar levels on a regular basis when you're at home and record those readings, and you can send that also to your primary care doctor to take a look at to see if you need any adjustments in your medications to help better control your blood sugar levels. If you suffer from obesity, it's imperative to get that under control because that is also another risk factor. If you have high cholesterol levels, there are medications that can help with this, or just practicing healthy lifestyle habits. If you smoke, it would be best to quit. I know it's not always easy to do this. I always say if there's a will, there's a way. There are many different resources out there to help you quit smoking and other addictive substances that you may be using. And another very important thing to do is practicing healthy lifestyle choices. So that doesn't just include quitting smoking and doing drugs or reducing or even stopping alcohol intake if possible, but it also involves eating healthy, more fresh green vegetables and fruits, less pro-inflammatory foods like red meats or meats altogether if possible, alcohols, reducing salt and sugar intake, stop consuming fast foods and frozen foods, eating fresh, healthy, and clean ingredients. My preference is a well-balanced vegan diet that includes all of the proteins and nutrients and minerals that you need. Some may need vitamin B12 supplementation, but you can easily get that from foods that are fortified in vitamin B12, or even just taking a vitamin B12 supplement over the counter if your B12 levels are low. Switch to homemade healthy meals where you get to control the ingredients, including your salt and sugar intake. Otherwise, getting regular exercise. I know not everybody is able to engage in exercise because of other medical conditions or other issues, but there are other ways to get that movement and that activity in. Sometimes even gentle, regular exercise can be helpful as well. But what I would generally recommend for those who are able-bodied includes aerobic and anaerobic exercises, at least 30 minutes per day, 5 days per week if you're able to. And you can even ask your primary care physician for this, and they can also help refer you to physical therapy. And a physical therapist can better teach you techniques that you may use for exercise if you have other medical conditions that hinder you from engaging in certain exercises. And it may seem like common knowledge, like, oh, Dr. PSP, we've heard about this before, eating healthy, exercise, but truly the benefits of this can accumulate and help to reduce the risk of future strokes happening and also make you feel good overall. It's good for your overall well-being. So why not take it a step at a time and incorporate these healthy habits into your lifestyle and cut out those habits and those substances and foods and beverages that are not conducive to your overall well-being. And another thing that you can do, which I strongly encourage, especially after you've had a stroke, is following up with a neurology doctor. Neurologists are brain doctors. They are doctors who you may follow up with after having a stroke. So make sure you make an appointment with a neurologist, especially after you've had a stroke. Finally, what are some signs and symptoms that you may need to be generally wary of, especially if your loved one has already had a stroke? What can you look out for? Now, like I said earlier in the video, patients who've had strokes don't always present with the same signs and symptoms. It really depends on the location of the stroke, the type of stroke, and many different factors. But generally speaking, there is an acronym called FAST, F-A-S-T. What does this stand for? You may look for facial droop. Is one side of the face drooping? Is one side of the face numb and tingling? A stands for arm, but really it should stand for limbs. Is there one side of the body, whether it's the arm or the leg or even both, that is experiencing new or worsening numbness or tingling or weakness? S stands for speech. Is the patient's speech sounding slurred? Or is the patient having word-finding difficulty? Or some kind of speech deficit that is new or worsened? And T stands for time. We always say in neurology, time is brain. In the number of hours, minutes, or even seconds that you wait to seek treatment, the brain is being damaged by a stroke, if a stroke is truly there. So don't wait to seek medical attention. Go to your hospital if you're having symptoms that may be of stroke. So I hope this video was helpful. This is just some general information. The brain, again, is very complex and people present differently, and treatments, including medications, need to be tailored to individual patients because everybody has different medical conditions and the same treatments may not always apply. But this, again, is just some general information. If you want information that's more tailored and specific to your particular condition, I would highly recommend reaching out to your doctor.
Wishing you all good health and happiness.